case you were looking for some guidance on implant placement in reference to getting a surgical guide, but just overall guidance on the case. So this patient is a patient, female in her mid to late 40s. The first thing I always want to know is what are the aesthetic expectations of the patient. So when we use CAT scans, it's very easy to place an implant where the bone is and then try to figure out how to get a restoration there. And restoratively driven treatment planning truly means the following: that you place a tooth in its ideal location and you create the endpoint, and then you try to figure out how to get an implant to support that. If we do that, we have to identify two things. One is there's a vertical deficiency, which means that the future tooth might be longer than what nature had intended that tooth to have if there was ample soft tissue and hard tissue. But there's also a horizontal defect too. So we have this rather significant buccal concavity here. So I think the important kind of distinction here is the following questions. Can we place an implant? Can we place an implant that will support a crown that will look natural? The first one is yes, we can place an implant there. There is sufficient bone, although rather tight. We can place an implant there and also at an angle that will allow us to emerge through the lingual of the incisal edge. But the second question is an important one to know whether or not we need to address it or not, and that is, do we have enough hard and soft tissue here to support a crown that's going to meet the expectations of the patient? So not sure whether you had the conversation or not with the patient, but this is definitely a situation that would benefit greatly from hard and soft tissue augmentation. So what I did, let's take the restoratively driven approach first. And what I did is I took a crown, digitally placed it, and gave it some general positioning that allowed us to say, okay, if this was going to be the future crown, how will the implant underneath it emerge? And can we get that implant to emerge at the proper angle? So if we look here, clicking on the implant, this blue dot is an axial extension of this implant, and we can see it will rather easily come through the lingual. So from a implant positioning perspective, in order to try to get this to be screw retained, this is definitely something we can do. We always try to aim for screw retained where we can. Would we be successful here in that? Yes. So I don't think there's too much of an issue with that particular part of the treatment planning. Sometimes we have to either upright the implant in order to get it come through the lingual, and in order to do that, we might have to do some grafting here. Fortunately, we're able to avoid that if our main goal is only to put an implant here. Let me just take a step aside and say horizontal grafting it's more predictable than vertical grafting, bone grafting. But when you have a concavity like this, it's rather predictable to do some bone grafting where you'd get 2 to 3 millimeters, and maybe even more, although you don't need much more than 2 or 3. It's a fairly predictable bone graft. Now we could have a conversation about doing that at the same time as implant placement, but I'll just say that I think this case might lend itself to doing some bone grafting for a couple of reasons we'll mention in a second. So screw retained crown could be entirely achievable here based upon the digital wax up that we put. But my bigger concern is the following. So let's just say the patient's fine with this rather long looking tooth based upon the deficiencies that we just outlined. My bigger concern is where this slice right here, which is this line, allows us to see where the implant is going to emerge in relation to the other teeth. And as you can see, that's rather palatally placed. In order for this crown to emerge from the tissue in a relatively normal looking fashion, there has to be a rather exaggerated emergence profile on the buccal, which, one, can look unnatural, and two, may not be the most periodontally sound situation. We ideally want to have some sort of convexity from the head of the implant platform to where the tissue emerge, or where the implant emerges from the tissue. We definitely don't want it kind of negatively placed. We don't want ridge lapse, and horizontal, although possible, isn't the most periodontally sound emergence profile. So if we want this crown to emerge, say right here, but the implant platform is right here, that's a rather horizontal emergence profile, which will then require a rather sharp angle of the crown. What that's going to do in the long run is increase the chance that if you have any recession in this area, that you end up having a rather unfavorable food trap or plaque trap. So we like to have more gentle slopes here for emergence profiles where possible. This particular case doesn't lend itself to that. Now, if we took the implant and we moved it, say, here, then we would have a more gentle slope, more natural, and one that fosters longevity of the hard and soft tissues in that area. So if we were looking for a more ideal situation, I do think this implant would be better served kind of at this angle, with the platform head being right there. Let's actually do that. And we're doing all of this planning not knowing the soft tissue profile of the situation. I'm just going to make the assumption that this patient has a moderate to thicker phenotype or gingival biotype. If not, then a whole nother conversation should be had. But in general, I think this is a pretty good position of where the implant should go. But as you see, we obviously would need to do some grafting in order to get there. And if the patient's open to that, then let's have a conversation about whether or not it should be staged, done ahead of time or done at the same time as the implant placement. This little bony protuberance right here and the soft tissue that surrounds it, and how the implant crown emerges from that, is the complex part of this whole treatment plan. Could you get away with just plopping an implant in there and putting a crown? Sure, but are you going to get the maximum aesthetic results and the maximum predictability long term? I would say that is in question, potentially. What I would say here, ideal treatment would be to do some ridge augmentation, where you thicken out the buccal aspect of the alveolar ridge. I would try to get some vertical bone at the same time, and then do some soft tissue grafting. All of those in an attempt to increase how much tissue we have in this area, hard and soft tissues, so that the emergence of the crown on the implant is as natural as possible, gives us the best aesthetic results, and has the best longevity from a periodontal perspective. All right, hope that helps. The whole point of this was to figure out the right angle for a surgical guide. I think we start that process once we've answered some of these other questions. All right, take care, man.